Hello friends, this is Shubham, and from today onwards I'm going to start some basic concepts in ophthalmology. I will discuss these concepts in ophthalmology along with some pharmacology topics. So I will continue with the pharmacology as well as in the ophthalmology, and today I'm going to discuss about the eyeball in ophthalma. So I will talk about the very basic structures in our eyeball, which is situated in our orbits or in eye sockets. So let's talk about what structures are present in the eyeball, and we will talk about the functions of these structures, and further in the coming sections I will be talking about the details of these structures. So let's talk about the eyeball and details of these structures. So here I am going to draw the diagram of the eyeball. Okay. So this is probably the structure of our eyeball. Okay. So this is the most anterior part, which is bulging outwards. Okay. And this is the posterior part. This is the part through which we see the objects. Actually, this outermost portion, is the cornea. This outermost portion is called as cornea. This is the anterior one, and the posterior one, this outer one portion, is the sclera. So what is it? This is a sclera. Okay, so this is the outermost portion of our eye. So actually, if we divide the structures, we have the outermost structure of the eyeball, we have the middle coat of the eyeball, and we have the inner coat of the eyeball. In the outer coat of the eyeball, we have two basic structures: cornea, the anterior one, and in the posterior section we have sclera. So this is the anterior one, this is the cornea, and this is the sclera. Okay, inside it, inner to it, there is another layer, which is middle coat, and which is vascular, highly vascular layer. So what layer is it? So here I am drawing the middle coat of the eyeball. Okay, this is the middle coat of the eyeball. This one, and this layer inner to it, this is the layer, we call it as choroid or choroid plexus. So this is choroid. Now this choroid will continue into the, as choroid will go anteriorly, the choroid will continue into the ciliary body. So here I am drawing the ciliary body. So this is the ciliary body over here. Okay, this is the ciliary body. And further, ciliary body is continuing into the ciliary body is continuing into the, this is structure, this is also vascular, and this is iris, which controls the proportion of the lights, that how much light should enter into our eye, so that we can coordinate with the quantity or amount of the light. So this is our iris. So this whole structure is called as uvea or uveal tract. So what structures are present in the uveal tract? So uveal tract, or uvea. This structured uveal tract is present in the middle court of the eyeball, and these include what structure they include? Choroid plexus, that is choroid, plus they have the ciliary body in continuation with it, ciliary body, and the iris. So this was about the middle cord of the eyeball. Remember, the middle cord of the eyeball is highly vascular. They have the supply of the blood vessels so that they can give the nutrition to the other structures of the eyeball. However, outer structure or outer cord, that is fibrous cord of the eyeball, that is avascular. They don't have any kind of blood supply out there. So uveal tract is present in the middle cord. They are present in middle cord of the eyeball. Middle cord of the eyeball. However, in the outer cord or fibrous cord, in the outer cord we have outer, that is fibrous cord. Which structures are present in that? They are sclera and choroid. Sclera posteriorly, and the more anteriorly is the cornea. Sclera and cornea. So this is the sclera, this is the cornea. Now, inside to it, we have talked about the outer fibrous coat of the eyeball. We have talked about the middle coat of the eyeball, which is highly vascular, rich in blood supply. And we have one more layer, that is the inner coat of the eyeball. And what is it? Inner coat of the eyeball. So I'm drawing with it. Okay. So this is the inner coat of the eyeball over here also. Actually, the inner coat of the eyeball is made up of retina, and the retina composed of two kinds of layers. They have the more outer one, which means under the choroid plexus, under the choroid, which is the part of uvea or uveal tract. Under the choroid, we have the pigmented layer present over there. So more pigment are present over there. So this is the, which I have drawn with the black color, this is the pigment layer or pigmented layer. And inside to it, besides the pigmented layer, we have the cells, we have the light sensitive area, which can perceive to the light. So this light sensitive area have the cells, you must have heard about them. They are rods and cones. So rod cells, they are working in the dark, and cone cells, they are working in the light. So that's why we, when suddenly we enter into the darker room from the light area, for example, we enter into the cinema hall from outside in the sun. So what we observe, that we can't see anything inside the theater. Why? Because when we are outside, our cone cells are responding to us. So they are responsible for the our vision in the light area. And whenever we suddenly enter into any darker area, so our rod cells start to respond, and after some time our pupils dilates, our pupillodilator muscles work, and our pupil is able to dilate, and our rod, with the help of the rod cells, we are able to see the things in the darker area too. So rods and cone cells are present in the neural layer or light sensitive area. So besides the pigmented layer, we have the one more layer, that is the light sensitive layer or the neural layer over here. Okay, and this pigmented layer which I've drawn, this pigmented layer continues with the ciliary body and as well as with the iris also, over here also. But these neural layer, or which have the rods and cone cells, they are not continuing till the ciliary body or iris, or very small portion of it is covering the ciliary body or iris. They are just up to here, prior to the ciliary body and the iris. So this is the neural layer I have drawn, and they are up to here. Okay. Now, let me name them. This was the choroid. This is the pigmented layer over here. Pigmented layer. Okay, so this is the pigmented layer of the retina, actually, and this the bluer one. This I will call as the neural layer, or light sensitive area. Light sensitive. Light sensitive. Now, let's talk about the lens. Where is it situated? Where is it located? So here we have the ciliary body. Let me name that these are the ciliary body over here. These are the ciliary body. Ciliary body. Okay. So besides the ciliary body, we have the suspensory ligaments, or zonules we call them as. Zonules. So look over here. Here I'm drawing the lens. For example, this is our lens, and they are bind with this. These structures are the zonules. So these are the suspensory ligaments coming from the ciliary body, and they are also called as zonules. They held the lens in the proper position in between the ciliary bodies. So zonules are coming there, and they are responsible for the adjustment of the lens according to the light coming into it. Okay, so these are the zonules. Zonules or suspensory ligament. Suspensory ligament. And this is our lens. Remember, anterior to the lens, everything is transparent. This area must be transparent so that light can enter into the eyeball, and we can see the objects. If it will be opaque, then there will be the pathology. The light will not be able to reach up to the retina, and if the light will not able to reach up to the antenna, we will not able to see anything. So this portion anterior to the lens, or prior to the lens, forward to the lens, it must be the transparent, and in physiological conditions this portion is transparent. Now the portion which you see here and here, actually here, this portion, is filled up with the fluid. This portion is filled up with the fluid, and we called it as vitreous humor. Vitreous humor. This is the jelly-like substance which nourishes the posterior section of the eyeball. So they are the jelly-like substance, the gel-like substance, and they nourishes our eyeball with some nutrients. Also, this portion, this is anterior portion, and we have this portion is filled up with the aqueous humor. And from where this aqueous humor is coming, this is produced by the ciliary body. Actually, the ciliary body is responsible for the production of the aqueous humor, for the washing out of the washing out and nourishing of the anterior segment of the eyeball. Okay, so that there could not be any development of the bacteria or anything like that. So ciliary body will produce the and will uh, be responsible for the production of the aqueous humor, and it will come through the posterior chamber. It will come through the and posterior chamber, and for example, this fluid, this will come into the posterior chamber here, and then it will come into the anterior chamber, and will drain into the Schlemm canal. Here we have the Schlemm canal. This is the Schlemm canal. But before that, we have the trabecular network over there. For example, this here we have the trabecular network. This is the trabecular network. So what is its purpose over there? It is also present over here also. The same structures are present over here also. For example, the trabecular network and the Schlemm's canal. Okay, this is the trabecular network, and here we have the Schlemm's canal. Okay. Now, the purpose, you understood that purpose of the aqueous humor is that it nourishes the anterior segment of the actually this is the anterior segment and this is the posterior segment. In the posterior segment is filled up with the vitreous humor, which nourishes, and with jelly-like substance which nourishes the posterior segment of the eyeball, and anterior segment of the eyeball we have the aqueous humor. It is produced by the ciliary body, and ciliary body will produce the aqueous humor through the it will first comes into the posterior chamber of the eyeball. Actually, the portion between the iris and the lens, this is the posterior chamber, and the portion between the iris and the cornea, this is the anterior chamber of the eyeball. So this portion over here, besides the between the iris and the cornea, this is the anterior chamber. This portion is the anterior chamber between the iris and the cornea, and between the portion between the iris and the lens, this is the posterior chamber. So this portion is the posterior chamber. So aqueous humor is produced by the ciliary body. It will comes through the posterior chamber and will go through the anterior chamber, will go into the trabecular network, then will go into the Schlemm's canal, because they will wash out the substances in the anterior chamber and in the anterior segment of the eyeball, and will drain through the Schlemm's canal. Okay. Now, if due to some pathology these angles may be closed, okay, and it is seen in more commonly in glaucoma. So you must have heard about the open angle glaucoma or wide angle glaucoma and the narrow angle glaucoma. So what happens in wide angle glaucoma? The angle is wide, it is not so close, but the problems in the trabecular network or the Schlemm's canal, so it will not be able to properly drain, and it will cause the increase of the intraocular pressure, okay, and which can cause the problems in the optic nerves, so it can cause the blindness even in severe cases. And narrow angle glaucoma is more dangerous as compared to the wide angle glaucoma, because uh, in this situation optic nerve affects more quickly and will cause the blindness. So we have talked about the many structures. Outer layer was the outer fibrous cord. We had the sclera and cornea. Sclera posterior on the posterior side and the cornea on the anterior side. Then we talked about the middle cord, that is more vascular, innervates the blood supply. So there we had the ovial tract. Ovial tract consists of the choroid in the posterior segment. Then we continue into the ciliary body, okay, on both the sides, and then we'll continue into the iris, which is so this portion is the vascular portion. Then we have the inner layer. Inner layer. In inner layer, what we have? In inner layer, we have the retina, and retina have the two portions. Then the pigmented layer, which is completely opaque, so that the light comes and it does not absorb. It should be reflected. So whatever light is coming onto the retina, it must be reflected so that we can actually see the objects properly. So if there will be the problems in the pigmented layer, okay, so it will not be able to reflect the light properly. Most of the light will be absorbed and will cause the blurring of the vision. So pigmented layer and the neural layer, or the light sensitive area. Okay. Further in the posterior segment, we have the vitreous humor. In the anterior segment, we have the anterior segment. We have the aqueous humor. Further, the portion between the iris and the cornea, this is the anterior chamber, and the portion between the iris and the lens, this is the posterior chamber. Okay. Now this portion between those two iris, this portion, there we have the pupil. So here we have our pupil. Okay. And with the help of the zonules or suspensory ligaments through the ciliary body, our lens is held over here, where these zonules and suspensory ligaments, they contract or relax and helps in the property called accommodation. So in accommodation, with the help of, if we want to see the objects more nearer to us, so the property which comes into play, that is accommodation. So accommodation helps in the contractions and relaxation of these zonules or suspensory ligaments, and will and our eye will able to focus on the nearer or far objects. So the zonules are responsible, and the ciliary body are responsible for the accommodation of the eye. They are contradictory to each other. For example, if the ciliary body will contract, the zonules will relax, and if the zonules will contract, the ciliary body will relax. So they works contradictory to each other. So this was the overall structures of the eyeball. In further sections, in further discussions, I will talk about the structures. For example, the sclera, the cornea. What are the detailed structures of the sclera? What are the functions of these structures? By the way, if I will talk about the functions of the middle cord, you can understand from it. This is the vascular layer, so it is responsible for the nourishing of the eyeball with the innervation of the blood supply. Outer coat is responsible for the protection of the eyeball. So sclera and cornea are responsible for the protection, and the inner layer is responsible for the vision, because whatever light is coming and falling onto the retina, it will reflect back and will cause the vision of and we can be able to see the objects clearly. Okay, so this was about the overall discussion over the eyeball. In further sections I will talk about the details of these structures. Thank you for watching this video and see you in my next section. Thank you.